All right, hello. This is Joey Donnelly contributing for COVID Culture, Saskatchewan Heritage's special project. With me today, which is Friday, June the 26th, is Bula Ghosh. Hi, Bula. Welcome.
Hi. Hello.
Hi. So, Bula, I guess the purpose of this conversation is to talk about COVID-19 and your experiences with the pandemic. Tell me about when you first started hearing about the virus and you started to realize of the serious nature of this pandemic.
I have to start a little ahead of that. Many years ago, and for several years, we've been hearing there will be another pandemic. There will be another pandemic, and so we just took it as a part in our stride. Never gave it any attention. Even when it started in China, we thought it was in China. Maybe it will not affect us, but when it did strike us very close to home, the first time that I felt really it is here is the day suddenly overnight they said at work, no, you cannot work from your workplace, you have to go at home. I suddenly realized the life is going to change. Now it has hit here. Before that, I knew it was coming, but I'd never thought so much about it. Then I started thinking that how it is affecting our lives, because my life it went at a turn of 360-degree, because I as a person, you I hold two jobs and most of the weekends I work, so I spend very little time at home. So I don't even have internet at home. I don't have TVs at home. Nothing of that sort to keep myself even engaged and entertained. So it was a big thing for me. Change overnight. I had to get Wi-Fi, and then otherwise I couldn't work from home. So it was one of the big steps. And then I realized that the seriousness of it and what it can do, because all the stories were coming from New York and China, as we had heard, but we thought it was so far away. Everything was under control because they had a whole city lockdown. Yes. So I thought it wasn't going to be that bad. But when it hit New York so badly and then we could close down, I knew it could be very serious. So what I did was I took the first week of contacting a lot of family I had not, friends I had not, and just wanted to say hello to them. Who knows what's going to happen with my age, being 70 plus. I didn't know that how it would affect me, so I wanted to do that. That's what I thought my first thing was about. It's saying hello to them and get in touch, that connection I wanted to make with people. I know that social distancing really struck a chord, that how much important the social life is. In my life, I being a single person, I don't even cook much. I would go out to eat, I would think, but I never do take eating outside as something that I would do to just feed myself, but it as a social event. Go out with a friend, go out with somebody. So that's a part that suddenly stopped in my life. So
That's that must have been difficult. Was there? I guess your employers are like the Saskatchewan Health Authority and Great Plains
yeah,
College.
right.
What one being the hospital, I'm sure that environment must have been a little more tense in some respects, eh? Or how did you keep that scheduling job too? Did you keep that up from
Yeah,
home? Or?
yes. What they did was overnight, as soon as the Saskatchewan government announced that people will have to stay at home and work, they changed the scheduling setup. So I do have a computer from them at home. They set us up from home.
Oh, I
They
see.
did that very well. The transition and the program, the incredible, task they did of getting everybody set up from home. So we do scheduling from home. I'm working for the college from home, and that part is working okay with the support. It's not that, even if we work from home, we have to have the human support. So sometimes I will connect with the staff. That human support is very important. That you cannot accomplish everything by connecting through virtual media, because there are certain tasks you have to sign, scan, and I didn't have a scanner printer, so I had to do that. So I think that that human connection that had to be disconnected, that feet apart and not be in the same space. Don't invite anybody who is not a part of your family in the house was the big thing. I think that social, that distancing, that one had to practice, because I'm, as a person, I'm out all the time and I like to go out and be with friends when I'm not working. So that was a huge change for me, that social aspect of COVID, I think. But then I realized that there are so many people who have lost their jobs. In that way, I'm fortunate. I didn't lose my jobs, but there's so many people who got affected. I was really glad that the federal government looked after them at that time, because I can't imagine that what would happen to the families that are threatened by COVID and they don't have the financial ability to look after their basic needs. So that was good. Whether it was enough or not, that's debatable, but it was psychologically a boost that the government was there for you. I think it helped a lot. I was also a part of that emergency fund distribution that was done in our community here, and I felt connected. I did make a small contribution, not much, but I thought if I'm going to look at other people's contribution, I should make some myself. So I did a small amount, but that was one way of understanding that what kind of need people were having in the community. And what struck me, that the socioeconomic divide that COVID demonstrated and just clearly showed that if you did not have the economic support and the good life, then you were more susceptible to COVID. Like, we live in southwest Saskatchewan, which is one of the most affluent area of Saskatchewan, as I understand, and we did not have a single hospitalization until recent. The cases in Maple Creek, and I don't know whether they had hospitalization. So
Yeah, and then with those socioeconomic differences, I guess during the pandemic, we've seen these outbreaks in communities like you mentioned, Maple Creek, which was on Hutterite communities, or what's been described as the far north and Indigenous communities. Do you feel like there has been an othering during the pandemic, or certainly there's been certain anti-Asian discrimination? What have you witnessed in regards to just discrimination, or just like how we approach and retain our sense of humanity?
you see, I personally, because I have not been so much of a victim myself, but when I see others being victim, I know that I'm also connected to the other groups. So I feel that I take it that way. But I know that there was a discussion initially in Canada that, unlike USA, Canada was not keeping a track record of how many people from which race, which group were being affected by COVID. They just took it as Canadians. And there were some people saying that we needed to divide it to reflect on which community was more affected. Like in USA, they said the Latino community, the Afro-American community were more affected, and the immigrant community. We were not keeping those records. But knowing what we know in Saskatchewan, the layout, we know the north is predominantly Indigenous. So when they say the north is affected, we know the Indigenous community is affected. And the Hutterite colony in the south, when they said that, the Hutterite colony, that was identified. So we know that the kind of grouping can cause that othering, and because somebody has told me who works in at this Walmart, she said, then when Hutterites come to the store, everybody tries to move away from them, and she includes herself, and telling me. So because of this reason, that we try to collectively group people. So if one Hutterite is affected, all Hutterites are affected, all the colonies. So we don't use our common sense. We don't have trust in our system, that our public health system works for us, that they will know that these people are quarantined and they are not coming out. So there are other Hutterite colonies. Somehow we don't use our common sense so much, and that is the sad part. But I'm glad that there is help in different ways. May not be enough. I know that lots of counseling support has been funded through Community Foundation, through United Way. I'm hoping that it's reaching out to the people. Yeah. hopefully.
You shared a picture with me today. I guess it was in response to the Black Lives Matter
Yeah.
movement. Tell me about that.
You know, for a town like a city like Swift Current, this is a first. During 9/11, there were rumors all over and people were fighting it. I know I was a part of it, but I never saw any posters come up. So when I have walked down the Speedy Creek walkway, I have noticed for the first time somebody's putting up 8 by 11 letter size posters, handwritten, very, very organic, no sophistication, but making a point that the history of slavery, Black Lives Matter, putting it in different places of the walkway. But 2 days later, I didn't find it. But then I saw something, it just struck me. I took a picture. You know why? That it was in somebody's apartment window. So you're taking ownership. You're not only sending a message, but you're taking ownership. You're connecting your space, very sacred living space, and giving a message to the world. And I was just taken aback that how much courage it takes somebody to do it. And I think I make a connection with COVID in this way, that people have realized in COVID how fragile life can be. So if we have to do something or say something, let us say it now. Maybe the person took it that way or felt so strongly, but if we have something to voice, I think it is good to do it now. And a few people are taking that, because who knows how COVID will affect us, or what will happen with life tomorrow, because we are realizing how fragile life can be. That, how people got affected with COVID, and the sources can be so varied. 80% of the deaths in Canada are in long-term care facilities. So those people didn't go out anywhere and bring the infection, but the infection was brought to them. So that is the way it can happen anyhow. So we have to be just very mindful of that. I'm in total admiration of the person who did it. I don't know who lives in that apartment. I would love to know.
A lot of people are saying that's what this time needs, are these moments of courage to say that Black Lives Matter or Indigenous lives matter. Could you reflect on just your experience organizing for Truth and Reconciliation in community, and how, given the context of COVID-19, we can kind of go forward in that work?
I know our reconciliation event got affected. We are not holding it due to COVID, but I am hoping that the last 3 years, what we did for reconciliation has had some effect, because ours is reconciliation events that we do is, we know that you can't change people's mind, they have to do it themselves. So we just try to provide the knowledge and say, look, this is the part of history that you need to know, and make up your own mind. So our last event that we are planning to hold next year is on introspection, that what does reconciliation mean to me as individuals. And I think at this time of COVID, when their guards are down a little, people perhaps are more gentler and softer in the way of thinking, maybe it will be time for people to start thinking that how important in life it is that to do what your conscience is telling you is right. Sometimes, our personal benefit, economic benefit prevents us from doing what we think should be done, because we see that we'll be losing a lot more in other areas. So maybe this is the time when we'll make those decisions that will be good for all, maybe for the environment, for humanity in general, because we know how fragile life can be, how easily today you can be healthy and tomorrow you could be in one of those ventilators and struggling for your life. So that's why we need to be very cognizant of the fact, until a vaccine is found, a medication is found, we all are vulnerable, and particularly the people who have less in their lives. And so we need to be helping each other. Yeah.
During the pandemic, were there any memories from childhood or during your life that kind of reminded you of the experience that you're experiencing during the pandemic, or was there anything perhaps that prepared you for this challenging time?
You know, when I was growing up, we had read about it in books, the Great Plague of England. We had read about it, and that how so many people died. We took it in a very impersonal manner because it's a part of history. I'm reading it for an exam and I'm passing it. But that came to light. Then I did more learning about the Spanish flu and what happened. So this was too close to home. Now with the learning of it helped and then I can realize that how many people suffered and died and how they died. Perhaps then because they didn't have the sophisticated interventions that we have today. And still, in spite of all that, we still saw that how it affected people in general. We don't know exactly about China. We know that they controlled it very quickly, but they had to do it by sometimes what I heard and read that to lock up people in their own homes so that they wouldn't go out. And in New York, people died so many at a time, they had to do mass burial. They did not have places to bury them. So that's the kind of a thing that brought it to home that it can go, how far it can go. We've been very fortunate in Saskatchewan. We didn't have to face it that badly, but in Montreal, it was not that easy and good, and even certain parts of Ontario. So, now we realize it, that how serious it can be, and we need to be cautious. We have never washed our hands so many times in our lives, and now that's what we do for it. Yeah.
Do you think you'll need to take on added precautions, or just people talk about this second wave? Is that something you're thinking about?
Definitely, it is quite the second wave. It is on my mind because as businesses open up and institutions, schools, colleges are opening up, and there could be a second wave possible, but it's just to wait and see. I have a sister in California, and she keeps on writing to me all the things that are happening there, and she lives alone, and she's always, today I got a little sore throat. Tomorrow she lives in panic because, in America, she's working in the gig economy. She is a contractor for that company where she works. She's an accountant. So the most of the other workers in that environment are all employees. So they at least have more protection than her. So she feels very vulnerable because if she's ill, there is no way that she's going to be able to claim EI or even get any pay from the company. So that she lives in that tension, and she keeps on texting me. Even this morning, she texted me that somebody in her company has tested positive to COVID. And so California is having a second wave now, huge wave, and their governor is rethinking now all the opening. So second wave can happen very easily. Only thing I say that as in Saskatchewan, we have the north affected, but not the rest of the province. It has not created so much of a impact on our healthcare. Our healthcare system has been able to manage it, but we should not take it lightly. We should still, follow all the precautions that we need to, and try and help each other. Whoever is at a little, needs that extra hand, let's do that for those people so that everybody can stay healthy, because the mental health and physical health have a very strong connection. If you're mentally okay, then say not very happy, at least at peace, then your physical health will also be better than it would be without mental peace. So that's why second wave might happen. And in USA, Texas and Florida and all, they are reclosing because now there's a second wave there after their opening of all the businesses. So it can happen. We cannot take it lightly. Just because it's not so strongly affecting our lives now, but who knows about tomorrow. Yeah. I think so. But I'd say that it has been a life changer, because only thing that the way we view life, we, at least as a person, I was very strongly opinionated in my life. I think I've become less of that. Let it be sometimes, let it go. And learning more to do that.
Well, that's important. And I guess I've been grateful that we do have our public healthcare system.
Yeah,
and
that's right. Absolutely. Stellar system that has worked with the people hand in hand and helped the people stay healthy, their public health. Because we know that people who had traveled abroad and all and should have been quarantined, sometimes they broke the rules. They did. And if because of our great system, public health system that worked very well for us, that we've been able to control it. And we still need to listen to what they are saying, whether we like it, whether it supports. Another thing that came up with COVID is that the sense of business, that, everything has to be done because, the businesses are being affected, being affected. So there was a very nice quotation. I think it was somebody quite well known. I read it on the internet that, businesses, if they're not making well now, the economic loss, that we made up with time. But the lives that we're losing now will not come back. So we need to be helping the people to stay at home and look after themselves, so that we don't spread the pandemic and affect some more lives. That's so good. And another one that I heard was, I never had a TV, and I read about TV, that this is the first time and that you'll be watching more TV and saving your country. Just lie down in front of the TV and do nothing and save your country. Because that's what it seems. But it is the sense of responsibility that we have, because we should be very careful and not make remarks that can be irresponsible. Like some people will say, it's just like another flu. I'm not going to bother. I'm not going to take precautions. It doesn't help. If you're thinking about yourself, it may be true for you, but the reality is every life affects the other life too. So when you go out without following any precautions, you are going to be the cause of other people's problem. So you have a civic responsibility of not, making remarks that are irresponsible, and also doing something that can harm the bigger cause of not spreading the pandemic. I know our leaders, some of them, the south of the border has been, making those remarks. It's Kung flu and all those, but it is irresponsible. We should not take it, to follow that path, I think. It is serious. New York, so many lives were lost. Why I mention New York? Because that was the closest I've seen so many people die due to COVID. It happened in Spain. It happened in Italy too. So many people died there. But the scenes that I saw in New York was horrible, and it's one of the most commercially vibrant city in the world. And everything came to a standstill over there. And they were calling for people to come and help them because they didn't even have enough staff. And so many people in the medical field died also. Their lives were lost because of other people contracting the disease, that, sometimes it happened without no, fault of yours, but sometimes people just did not heed to the whatever precautions they had to take, and they spread the germ everywhere. So it is a time for reckoning that, as people need to, and the lack of social distancing has told people as a reminder how much our social well-being is important for us, that human interaction, how much it is valuable in our well-being. Wow. That how much we missed it. I've had the fortune, I don't know whether I did it right, I went to Regina once in a while. My sister lives there. in the weekend, and we were together because I lived in their house for many years ago together we were. So I don't know, I just did that. And so that was for another thing that, that the human contact.
Yeah, it's innate. We need that. Like it
Yeah.
is. You hear it often nowadays. We are social creatures.
Yeah. So I went to Regina, every other weekend or so for 2-3 days, and that's how I met my social needs.
Yeah.
But we were maintained the social distancing, but I went to her house. Yeah. So that's the part of this COVID. And the other thing is, the other people's lives have been lost. Families have had to go through hardship when they could not meet their near and dear ones because they were separated. And then the person who was affected by COVID passed away, and they could not even say goodbye. So those were the things that has taught us big lessons, that how our system has to change, that that the healthcare system, that how we pay so little to those workers who provide such an important service. They don't have full-time jobs, part-time jobs. They're running from job to job, and that was one of the reasons for the infection to spread. Then they found out. So maybe some good will come out of all this hard experience, that there will be better working conditions for the people, frontline workers for the healthcare. Let's hope that it turns out to be so.
Yeah.
Because so many of them work multiple jobs, part-time jobs. And that was one of the reasons the infection spread from one institution to the other.
You're thinking like in particular like Quebec and Ontario. Yeah.
Because in time, when it started in Vancouver, their public health officers stopped workers from working from one institution to the other. She stopped it at very early stage.
Oh, good.
So the spread was not that bad. But Quebec and Ontario had a lot. Even here, what happened is when they saw the experience, ours was a little slow spread because maybe of our population. And the minute they realized that this was a possibility, they stopped for workers from going to multiple centers. Already, it was done at a very early stage. But in Ontario and Quebec, this is a big problem because they have the privately run businesses in long-term care, and they are trying to cut corners to make the most profit. And that is the reason why that perhaps they don't concentrate so much on good, working conditions, benefits for their frontline workers who provide the service to their clients. And that's 80% of the seniors passed away as a result of the total numbers that we see that passed. Out of them, 80% seniors in long-term care facilities.
My goodness.
Yeah, that's what the numbers were yesterday. So that's why I hope that out of this will come. And the other learning that came is that we all were tested for our online capacities, how we can work from home and do online work, get onto Zoom. So our skills in online meeting, online services has improved tremendously, but it does not take away the value of face-to-face, but it is an alternate, and it's a skill that we learned, because we were under pressure. Whether we liked it or not, everybody had to. So that was another, in spite of all the hard things of COVID, that's another gift of COVID. I think our labor conditions for the healthcare services providers will change. Our attitude towards online education will change. And also the third thing is that the socioeconomic divide, I hope that can change. I know that most of the our Salvation Army food banks, they got a separate money from the government. They did not ask for money from the emergency funds, but they were very busy providing food to people who needed it. They were busy.
There is a lot of need out there. Thank you so much, Bula, for taking the time today.
Okay, I hope I got what you needed. I hope they do.
You certainly did, and then some. So thanks again.
Thank you.